Like we like to do every Tuesday now, we're talking about COVID in Connecticut with Dr. Syed Hussain from Trinity Health of New England. And even though there hasn't been a lot to talk about lately, today there is. So I'm glad you're here, Doctor. Good to see you again, sir.
Thank you. Thank you for having me.
All right, first things first. Washington Post just came out with an article saying that a lot of health experts across the country are seeing kids now not just getting COVID, but getting multiple viral infections at once, including some viruses you wouldn't think they would be getting when the weather is warmer. What is behind that?
Sure. So there are a couple of reasons. First and foremost, the public health measures that we had in place for almost 2 years now are, for all intents and purposes, gone.
Yeah.
So those were really helpful in protecting children and protecting everybody for that reason from not only COVID, but other respiratory viruses. So they're back. They've been here, and now folks are getting infected. And the other thing is there might have been a dip in natural immunity because people weren't getting infected and weren't developing antibodies against these viruses that, you know, always have been there. So those are a couple of reasons why we probably have seen an uptick. And even influenza, it hasn't gone down as much as it usually does by summer.
Yeah, and you know, that's a very interesting point that you brought up. The seasonality is just because a lot of people do tend to get it, and it sort of snowballs, but when you break that cycle, all of a sudden people are getting the flu in the summer.
That's right.
Okay, you were saying before, a lot going on the FDA front, a lot of parents still waiting to see what's going on. Is my child going to be eligible? And then if they are, should I get my child vaccinated? What goes into that decision making for parents?
So data. So we need to make sure that these vaccines are safe and effective for ages 6 and below. So there are a couple things happening today and tomorrow. So today the FDA, the advisory committee looking at vaccine data, is looking at whether to give the green light to Moderna from age 6 to 17.
Yeah.
This was put on hold last year because of concerns related to myocarditis. So we expect that approval to come through. And then tomorrow, they're going to be looking at Pfizer and Moderna data for ages 6 and below. We do anticipate getting approval from the FDA and then the CDC later on in the week. And so shots can start going into children's arms in this youngest age group as early as next week.
A lot of the decision making regarding that, are they just looking at what the benefits to the children versus the drawbacks would be, or are they still trying to look at it from a community health perspective in that if you get your child vaccinated, they're that much less likely to transmit it to an elderly family member who might have a much tougher time?
So I think it's a bit of both. So yes, children don't tend to get as severe disease as adults, but we've seen some complications come through in children, so that it would help protect children against those complications. And then the other thing is, to your point related to transmission, it's important that, you know, the more vulnerable people in our society as we open up now are also protected.
Yeah. What do we know about reinfection from COVID at this point? A lot of experts are saying this is something that you could expect to get once a year, maybe more than that. But what do we know about the ramifications of getting it more than once?
So there's good news and bad news. Bad news, yes, it appears that folks, even if they're vaccinated, are coming down with reinfection. The good news is it's mild. We're not seeing an uptick in hospitalizations that we've seen before. Yeah. We do know these newer variants, including BA4 and BA5, that are now increasing steadily in the country, are causing less severe disease, but they're more contagious as well.
Yeah, and I'm curious to see going forward what that does with the likelihood for people of getting long COVID. And again, I think that's more of a statement than a question. There's just a lot we don't know at this point.
That's 100% right.
Yeah, well, okay, that's one thing we're going to talk about more. There's a lot of studies being done, so certainly we'll have more to talk about this time next week. Doctor, thank you so much. Dr. Syed Hussain from Trinity Health of New England giving us his wisdom as he does every Tuesday morning. So make sure, if you like these segments, check back this time next week.